Welcome, everybody, and thank you all for coming. Today, our special guest is Dr. Ara Shafrazian, and he's going to talk to us about hypertension, diet, and medication. And I am going to, with that, I'm going to have him take over, and he will introduce himself, and then he'll go right into his presentation. Thank you so much, Doctor. You're up.
Thanks, Melissa. Thank you so much for having me. Hi, everyone. I'm Dr. Ara Shafrazian. I'm a family medicine practitioner, primary care provider here in Glendale, California. My partner and I, Dr. Arthur Babakanians, have a practice together. Unfortunately, he had to cover me in the hospital, so I'll be giving the presentation today, and hopefully everyone will get a chance to meet him in the future. Just a little bio about me so everyone can kind of get to know me. My partner and I, we grew up in Glendale together. We volunteered at Glendale Adventist when we were 17 or 18 years old. So our goal was always to come back from medical school and residency and give back to the community and come back to Glendale where we started our roots and started our passion for medicine. So we're happy to be back and have a primary care practice in the community. We work very closely with Glendale Adventist. We see our patients in the hospital. We see our patients in the nursing homes. And we often do home visits as well and take care of our patients who can't make it to the office. So we like to provide complete care no matter where our patients are. With that being said, I'm very happy to give a presentation today to everybody. I'm going to be talking about hypertension, which I know is a very common topic. It's something that we discuss very often with our primary care providers, and we like to maintain a good blood pressure. And today I'll go over those important topics because it is a very important disease and something we can avoid and prevent complications of. So I was kind of prepared for an in-person presentation. So I had a poster board kind of ready, but it'd be tough for me to use that in Zoom. So I'm going to talk about things and try to break it down as easily as I can so it's easily digestible. So I have 4 different points that I'm going to go over, and I'll run through that table of contents right now so everyone has an idea of where I'm going with things. So I'm going to be talking about hypertension, what it is, what its implications are, how do we diagnose it, how do we treat it, and how do we prevent it from getting worse by just making lifestyle modifications. So first I'll go into what hypertension is, what does it mean, how do we diagnose it, how do we take a proper blood pressure. Second, I'll go over what are the causes, why do some people have hypertension or high blood pressure and some don't have it. Third, we'll discuss the implications. Why is it so bad? Why do we care about it so much? What does it cause in the future if we don't take care of it? And lastly, I'll discuss how do we treat it, both via medications and, more importantly, adjusting our diet, adjusting our lifestyle, and making those small changes to bring down the blood pressure. All right, so I'll start with what is hypertension? What does it mean? High blood pressure. What are the values that we often see, 120/80, when we discuss those numbers? So the numerator, the number on top, signifies the systolic pressure. Systolic pressure refers to how much pressure the heart has to go up against when it's squeezing to get the blood out. So every beat per minute that you have, it's squeezing blood out. And how much resistance there is that top number. So we like that number to be less than 120. That's always our goal. Historically, that's been the number we use and is what we strive for. Second number, the denominator, is the diastolic value, which is the pressure when your heart's relaxing and opening up and letting that blood come in and fill up the heart so that it can push it all out. The pressure that the diastolic number is that pressure. So we don't want that to be too high because it puts a strain on the heart from trying to fill up enough blood. And if there's too much pressure, can't fill up enough blood, and then our body won't get enough nutrients and oxygen that it needs. So that's the systolic over the diastolic. So that's what the blood pressure means. Now, what is hypertension? When is it too high? Historically, the goal has always been 120/80. Recently, there were some guidelines over the last few years that said, well, wait a minute, we can probably get away with 140/90 as the goal before we start medical treatment. Many neurologists and cardiologists didn't like that. A lot of people still stayed back on the 120/80. Some practices did increase that value and used 140/90. But now the newest guidelines again reiterate that the goal blood pressure is 120/80. That's the ideal blood pressure to prevent the complications that we're trying to avoid. So with that being said, we've discussed, what are those numbers? What do they mean? What is the anatomy related to those? Systolic is squeezing the blood out, so we don't want too much pressure. Diastolic is relaxing the heart and filling blood in there. So that's what the meaning of each value is. Now, how do we measure this? When you use a blood pressure cuff, I'm sure many people have them at home, or when you go to your doctor's office, the first thing they do is check your vital signs, a blood pressure, a temperature, and we use the blood pressure cuff, which measures millimeters of mercury is the measurement we get. So that 120/80 is measuring pressure with a unit of millimeters of mercury. And how do we get an accurate blood pressure reading? This is a very common question. Sometimes we don't take the blood pressure completely correctly, and therefore it can skew the values. It can be too high or too low. So what's important, especially at home, is that we're not eating or drinking 30 minutes before we take our blood pressure. No coffee, no sweets, no sodas, water is fine, but no big meals, no heavy digestion going on right before we take our blood pressure. And the rule is 30 minutes. That's the rule I always give my patients before taking their blood pressure. 5 minutes before you actually put the cuff on and press the button to start the blood pressure monitoring, you need to be sitting down with your arm at the heart's level over a pillow or over something that can hold your arm up. Blood pressure cuff will go on the left arm and it'll stay at the heart's level. And for 5 minutes, you're not doing anything. You're relaxed, you're not talking, you're sitting down, taking regular breaths, you're not stressed, you're not anxious, and you take your blood pressure like that. You can take it again 5 minutes later and get an average of the two blood pressure values, and that'll give us a good idea, two separate instances 5 minutes apart, of what your blood pressure is. A rule of thumb that I like to use to get an accurate value is I tell my patients, take the blood pressure at the same time of day, every day or every other day, however we need to do to monitor it. But it's good to take it at the same time because usually we won't have huge fluctuations in our mood, in our stress levels, in our diet if we take it at the same time. So that is what's important to know as far as checking your blood pressure, what the blood pressure values mean. And then now we'll go into some of the causes, and I'll lead into what happens if we don't treat the blood pressure. So the second subtopic is, what are the causes of high blood pressure? Why do some people have high blood pressure and some don't? So there's many factors. There's two big groups, however: primary hypertension or high blood pressure and secondary hypertension or high blood pressure. Primary is when we don't have any other causes and you come in, you feel great, there's no other problems, and your blood pressure is elevated. That's the most common type of high blood pressure, and we call that essential hypertension. And that accounts for about 94% of all high blood pressure diagnoses. And that would be, there can be environmental factors such as diet, lifestyle, lack of exercise, increased weight, smoking, environmental pollution. All those things can be bundled up into a primary hypertension. It can make it worse. And of course, family history and genetics. So some people might be perfectly healthy, exercise every day, eat the perfect diet, but still will have a little bit of a elevated blood pressure. And we attribute that to genetics and family history. The second type of or subgroup of hypertension is secondary hypertension. And that's usually because of a specific source. Could be our hormones from our adrenal gland, could be our sodium or our potassium or too far apart from each other, could be an arrhythmia that's causing the high blood pressure, or thyroid disturbances. Sometimes diabetes can cause elevation in our blood pressure. So whenever we can identify a source of where the blood pressure is coming from, we call that secondary hypertension. And we treat that problem, and that will bring down the blood pressure. But when we don't have something to identify specifically as a source, we call it essential primary hypertension. So those are the two subgroups of what type of hypertension we have. So now that we've discussed the different types of hypertension, I'd like to go over the implications. Why is it so important? Why do we always check your blood pressure the first thing when you come in for a visit? And why do we care about it so much? Why do we call it the silent killer? Most of the time, or almost all the time, there really isn't any symptoms with hypertension. You can have a blood pressure 150/90 and feel great. Or maybe once in a while, I get a slight headache that you might attribute to something else. But over time, over the years, that blood pressure has implications on different systems of our health. The neurovascular system, increases our risk of stroke. So the most common cause of stroke is an ischemic type of stroke, and that's usually related to hypertension and damage to our arteries because of that constant pressure hitting the arteries, hitting the arteries, hitting the arteries, and that causes calcification and damage and plaque buildup, and that could lead to a stroke. So one of the main reasons we want to control blood pressure is because we want to prevent stroke, and that's one of the most important reasons why we want to keep the blood pressure down. The second reason is, or constellation of reasons, is coronary artery disease or heart disease, more commonly known as, is when I just discussed the arteries getting damaged by the high blood pressure and that pressure constantly hitting the arteries. That will cause blockage of the arteries that lead to our heart and give oxygenation and provide nutrients to our heart. So when we do that, the heart will get more and more strained, and eventually it won't have enough oxygen, and that's what leads to a heart attack. So the coronary artery disease ends up leading to heart attack or myocardial infarction. And that's another big problem that we don't want to have happen to any of our patients. And we want to control that blood pressure to prevent it from happening in the future. Now, does it happen over weeks or months? No, it's usually years. So we have some time to bring it down. And that's why it's important to talk about the topic constantly and reiterate it to all of our patients and make sure everyone knows why it's so important. And lastly, another aspect of hypertension affecting our heart is heart failure, congestive heart failure. And that again is related to the pressure that the heart has to undergo to get all that blood out or to allow that blood to come in. So if your heart has to constantly press and press, squeeze those muscles and shoot that blood out against a lot of pressure, then it's going to eventually get tired like any of our other muscles. If you run marathons every single day, eventually those muscles are going to get really tired and they're not going to be able to keep going. So same type of deal with our heart, because it is a muscle, a very strong muscle, but over years of hypertension, high pressures, it gets weaker and weaker, and eventually those muscles are not able to squeeze out the blood anymore, and we develop congestive heart failure. And that will cause big issues such as fluid building up into our lungs, fluid building up in our lower extremities. So another big reason to make sure that our blood pressure is always well controlled, to prevent those, really the three biggest problems: coronary artery disease / heart attack, congestive heart failure, and prevention of stroke. So those three big problems are really what we're trying to prevent, along with other different issues such as artery disease in our lower extremities, vision problems, chronic headaches, which can also be very detrimental to our health. So those are the main implications why we want to prevent hypertension, why we want to treat it and make sure the blood pressure is always controlled. Now, the biggest topic, most important, is understanding how we treat hypertension and what do we do? What are the steps? How does it work when you go into your doctor's office and he tells you you have hypertension or your blood pressure is too high? Why is he or she giving you a medication or telling you to decrease your salt intake? And we'll go into that now. So the first step in treatment of blood pressure, depending on how high the blood pressure is. If our blood pressure is less than 140/90, I'm always comfortable giving a trial of 3 to 6 months of change in our lifestyle and diet. Now, what does that entail? Or what does it mean to change your lifestyle? We look at the diet, and oftentimes I refer to a nutritionist to reiterate the topics and go into detail on specific foods. So the core basis is avoiding foods that will contribute to artery damage, plaque buildup, and increasing blood pressure. And oftentimes it is directly related to our salt and potassium intake. So the more salt, oftentimes the more water retention, thus will increase our pressures and cause damage to those arteries. And conversely, the more potassium we take in, the better for our blood pressure, and it's known to bring down our blood pressure. And sodium and potassium, they work kind of against each other. Sodium goes high, potassium tends to go down. Potassium goes up, sodium will come down. So we focus on diets that encourage high potassium, low salt, low fat, low cholesterol, low in fried foods. So I actually just returned from Greece on a short vacation, and talking to some of the residents there and some physicians that I met. Blood pressure issues or hypertension in Greece is not very common because they follow the Mediterranean diet, which is big in fish, green leafy vegetables, yogurt, different salads, and they really avoid red meat, high salt foods, preserved foods, and so that prevents blood pressure from developing. Now, the key in the diet, when I mentioned Mediterranean diet, oftentimes that is known from the American Heart Association to be the best diet for keeping the heart healthy and preventing high blood pressure. So more fish, less red meat, less foods that are high in cholesterol and fats. So anything that's fried, anything that's really preserved, like deli meats, salamis, hams, turkeys, they have a ton of salt. Anything prepackaged usually has a ton of salt in it. Increasing potassium, Mediterranean diet includes lots of nuts, almonds, cashews, which are known to have good fats, omega-3 fatty acids. Also low in salt and provides a ton of fiber as well. Also, the green leafy vegetables. Why those are so important is because of the rich potassium source that it is. So the more green leafy vegetables, the more potassium we get in our diet, thus also decreasing the amount of salt that we get. So those are the core principles of bringing down our blood pressure with our diet. So when we say diet modification, it means cutting out the red meat, cutting out the salt, increasing the potassium, the omega-3 fatty acids that are in many fish dishes like salmon, like tilapia, and trying to stay away from frying any of those and baking them using herbs and spices versus salt. So that's what we talk about when we discuss diet. Now, it's really important to know that adjusting the diet will drop your blood pressure between 5 and 10 points. So that's what we've seen in studies over the years, is that just adjusting the diet can drop your pressure between 5 and 10 points. So that's a good amount. It might sound like a small number, but when we add it to the rest of the stuff I'm going to talk about, it becomes a huge improvement. So that's as far as diet, lifestyle in connection with our diet. Now, exercise. The most important way and the most effective way to decrease our blood pressure is exercise and weight loss. Weight loss is shown to decrease blood pressure up to 14 points, depending on how much weight we need to lose to reach a healthy body mass index, which is between 18 and 25. And the body mass index is essentially a measurement of your height and your weight, and it gives us that number. And we strive for a number around or less than 25. So depending on how far we are from that number, the more weight we lose, the better the blood pressure will drop. So exercise is a big factor in that. 30 minutes to 45 minutes of brisk or moderate exercise, meaning walking or working on a treadmill, going up a hill a few times a day, causing you to sweat, causing your heart rate to go up. Of course, depending on how much you can tolerate, that will improve not only your circulatory system, it will bring down your weight, and it will make you feel much better as a whole in general, aside from helping bring down your blood pressure. So those are the two big factors: lifestyle, which is exercise, which is diet, which will help bring down our blood pressure the most. So if we adjust our diet and we exercise as well, right there we can drop our blood pressure between 10 and 20 points. And that is usually enough to not require medication. Now, as far as medications are concerned, that is very specific to each patient and the blood work that we receive. And we check your kidney function, liver function, sodium, potassium, and based on that, based on your background, based on your family history, your primary care provider picks a medication that suits you best, that helps bring down the blood pressure, considering your specific situation. So I won't get into those different medications specifically and try to focus more on the lifestyle and diet because it is so specific, those medications that we use. Now, those are the most important factors. And in general, I've seen that if we really try hard, 3 to 6 months is a great amount of time to bring down the blood pressure. And sometimes it doesn't bring it down all the way, but it can save us from using 2-3 medications to just using one medication. And those are the important factors to realize, is that we can make a lot of changes in our health just by taking care of our body, exercising, eating the right foods, and we can still splurge and have some pizza or whatever we like to eat once a week or once every 2 weeks. It doesn't mean we have to cut it out completely. Now, those are the 4 main topics I wanted to talk about in regards to hypertension. And I know there may be some questions on each one or specifics, and I'm happy to go over those now with everybody and clarify anything that wasn't clear.
Okay, so we're going to stop the recording before we start the questions.